With the coronavirus pandemic, a number of changes have occurred in the way that we take care of our patients in medical oncology. And I think one of the things that we have learned, and I hope we will continue to take forward even when the pandemic is under control, and hopefully that will happen soon, is that doing virtual visits is a effective way of helping to care for our cancer patients, especially those that are long-term, either doing well on, for example, TKI therapy and have done well for years, or if we're doing a surveillance visit where we're updating scans and making sure things are okay. Talking to patients through virtual visits is really a nice way to provide care. It eliminates, of course, having to drive in, park, manage their way through our academic institution. And it also it allows for doctors to see patients in other areas of the country. So sometimes there is a significant travel component that some patients have to do. And it's nice because we can just, visit them in their home. So I think that's one of the major points of change I think will carry forward even after the pandemic. Our understanding really crystallized as we sort of got more information about the virus, as well as tried to continue practicing, and that is cancer doesn't wait. When people are eligible for curative intent therapy, we should do everything we can to provide curative intent therapy, as per the normal standards outside of the pandemic. There was a really interesting article in, I think, the British Medical Journal. But what it did is they took a number of registries and data points to better understand what the cost was in terms of outcomes for delay in cancer therapy. And so they were able to look across a number of different cancers, and really what they saw is that even a 4-week delay, or even more than that, could reduce the chances of patients being cured. And I think that has played out in our clinical practice anecdotally. Patients, unfortunately, are coming to us with more advanced disease. We're seeing the early stage cancer patients less. And I think that was in part because of what we were offering to do, trying to just keep it to the bare essentials, as well as patients being afraid to come into a large medical center where there are, people who are not well. The other ways that we've worked around the pandemic, of course, are structural things, meaning, fewer visitors are allowed coming into the appointments with the patients, or when they're, in their infusion, we limited it to one additional person. And then, with our patients and the changing landscape in terms of distribution of the COVID vaccine, we're also, actively keeping them updated with what our specific institution is doing, as well as the conversations that are going on as to when they could potentially expect a COVID vaccine.